Hi, my name is Anson Koshy. I'm a developmental and behavioral pediatrician in Texas, and I am here to provide a call to action to my fellow pediatricians and other healthcare professionals working with children, all children, when you're seeing them during well child visits, to think about all of the little ways we can ask or raise our suspicion for a possible underlying dyslexia diagnosis. So when we think about dyslexia and it being a language-based learning difference, I always like to remember that framework or definition of dyslexia, because it reminds me that any child I've seen who has a language delay is already at risk for a further diagnosis of dyslexia. So if you have a patient that has a history of a speech delay, needing speech services when they're very little, have a low bar to kind of ask more questions and monitor them in those early pre-literacy years and preschool years. If there's a family history of dyslexia, I also find that to be really helpful, and it's something that the AAP also notes that is useful when you're thinking about when do you go from screening to recommending more formal testing. So family history is key. Asking very specific questions with kids, sometimes you don't, especially pediatricians don't have a ton of time to do all the things that primary care is really known for. And so asking a few questions of a young child about phonemic awareness, writing a letter and saying, hey, do you know what this letter is? Great. Do you know the sound that goes with this letter or what sound this letter makes? Asking those questions are also helpful if you're seeing those early signs of lack of phonemic awareness. Even asking about rhyming words. I'll say something like, can you tell me a word that rhymes with star? It could be a real word, it could be a made up word. And if a child is struggling with that as well, another little box is checked in my mind, thinking about, okay, how am I gonna kind of get more details, more information, and move from screening to testing? Other things that I always think about is, particularly for kids who come in with an ADHD concern, whether the ADHD concern is coming from teachers and parents or both, is to think about all the other things that can occur with ADHD, including dyslexia. I think it's so much easier to screen and diagnose ADHD in primary care and in medicine in general, that sometimes that dyslexia component gets missed. So kind of thinking about that when you're seeing really any kind of mental health diagnosis, whether it be ADHD, anxiety, or depression, we know those things commonly occur in the midst of an underlying language-based learning difference like dyslexia. So we ask pediatricians to do a lot. It's kind of hard because they're already doing a lot, and they're, I think, tackling a lot in a very short visit. So what I found that's helpful is connecting with people in my community, local experts who are familiar and very much immersed in the world of dyslexia, whether it be in advocacy realm or the remediation realm. So one of the best ways I found to do that is connecting with a local advocacy group. So I had the good fortune of connecting with one in Houston, a local nonprofit, where we have academic language therapists, educators, school administrators, psychologists, diagnosticians who are members of not just our board, but also who make up our membership of our organization. And the longer I've been in that organization, the easier it is for me to kind of understand what someone role may be in advocacy, and kind of quickly getting in touch with them and saying, hey, what's the latest on this legislation? Or what's the new regulation? Are they enforcing it? So that's a great way to kind of get some support in the community from local experts. So you're not necessarily feeling like you're kind of on your own doing this. Lastly, I would just say, there's always more to learn. There's a lot on the horizon when it comes to dyslexia and diagnosis, and there's a lot of work on neuroimaging related to diagnosis, but I don't feel like we're going to get there soon enough where it'll be clinically useful. But a clear history, some really simple questions can really help you raise that level of concern and kind of help you direct a family to the services that they need. Thanks so much.